Hi. So I'm a pediatrician. I'm Dr. Deepthi Chopra. You've just heard a lot about Virtue Baby and the whole thought process that goes into it. So at the end of it, your healthy baby is delivered, and the whole idea of today's session is that it all starts in the womb, and then of course after that when your baby comes, we are there to take care of the baby. This session is to sensitize you to some of the common problems which babies face, because as new parents we are taken aback by a lot of things. We read a lot. There is Google, of course, to help us all the time, but that's not hands on. There are lots of things that we see that parents come to us in a panicking situation, which are most of the times normal. So that's why we call it normal newborn care. There are a lot of phenomena that don't happen in older children but are very peculiar to newborns. So I would want you to come up with any doubts that you have, anything that you would want to know about baby care, or that you would have heard from your relatives or whatever. So the whole idea is successful transition to home. Okay, it starts with your obstetrician. It starts in utero, the neonatologist who receive your baby in the nursery. It's a lot of nursing care. In the first few days you would need help in nursing, you would need help in feeding the baby, in changing nappies. We are there for all of that. You would need help for lactation is very difficult to establish early on, but it just needs a little patience. Once you tide over those 2-3 days, there's a bond that is established between the baby and the mother, and that goes a very long way in feeding. So the first few days are very important. All the thought that you have, all the positive ideas that you've got about feeding are important, and finally you get a healthy and happy baby with who you take home. What do we do when we receive the baby? Immediately, so the baby is very comfortable inside. There's a temperature that is maintained. The baby is warm. Normally the baby is in a fetal position, curled up like that. Suddenly the baby is out into this big bad world. So the first thing is there's a temperature difference that the baby feels immediately. So we keep the baby under the warmer. We normally preheat a warmer because we know that the baby is out into the cold. So a temperature instability is a very big thing for the child. The baby comes out, we keep the baby under the warmer. You will hear the first cry. The first cry is very, very important. More than you, we are happy to hear the first cry, because that tells us that this baby is sorted. If the baby has had a good first cry, that means the lungs have opened up, the baby is breathing. So inside the baby is not breathing. There are breathing movements, but there's no air exchange happening. So the cry is the first gush of air. So the cry is very, very important, and as pediatricians we are so happy. Our work is almost over once we hear the good cry of the baby. So of course at birth itself there are some injections like a vitamin K which we give in the labor room, because they're very important, because they prevent certain problems, and we assess the basic growth of the baby. You have an in utero idea of, this will be the baby weight, this is the expected weight, but once the baby comes out, we just assess the anthropometry. This is what we do immediately when we receive the baby. We clean the baby, wrap the baby, and give the baby to you. The baby, when the baby is born, there, you might have seen some pictures or heard that there's a lot of white stuff that's deposited on the baby. Traditionally we used to clean it, but now they say all that is good. It again helps in maintaining the temperature of the baby. So we don't aggressively clean the baby, we just pat the baby dry, and all that goes off in a day or two when we sponge the baby. But all that is also really good. So according to me, anything that you get from the mother is good. There's nothing, no way a mother can do wrong to her baby. It's like inbuilt. So you're carrying everything. So all that is really good for the baby. When you receive the baby, there are certain things that you should be prepared for. Your first layer of clothing for the baby should always be cotton. We do not want any synthetic materials, any woolen materials to directly touch the skin of the baby. Especially in the first month of life, the skin of the baby is very, very gentle. So the skin is very thin, so we don't want you to layer up on clothing. There are stretch suits which you get for the winters. Now the winter is almost going. What we tell when we say in winters how should you dress the baby, you should dress the baby in layers. You should not go on wrapping, you should dress in layers, so that you can remove a layer or put another layer on. You can use light blankets. You get even blankets which are like sleep suits. When you are not used to sleeping with a baby, And in our culture, co-sleeping is a very good thing. We don't normally put our babies in cots directly, probably like what happens in the West. And co-sleeping is very, very good for the baby. So the baby gets the warmth of the mother. The mother knows when the baby moves. You know, you follow the cues of the, but at the same time, there has to be some safety which has to be followed, because we are not used to sleeping with the baby, and also we are so tired in the initial days when the baby is born. So that's why they say that you should be very careful with the blankets, and the blankets should not inadvertently fall on the baby's face. That's why you should just be careful about all those things. And if you see in that picture, the baby, there should be no heavy blanket on top of the baby. It should just be either wrapped, like mummified, or you should layer the baby. Okay, but you don't keep a blanket like you take a blanket on yourself. So it's very important to maintain, all this is important to maintain the temperature of the baby. You don't need to keep checking the temperature, but how do you know that a baby's temperature is fine? Your palms and soles are normally pink, okay? Sometimes and the body is also warm. Sometimes if the baby has a cold stress, like if the weather is changing, you may find the hands and feet may be slightly cold. The body still stays warm. So you need to feel that warmth. Once you are with the baby, you realize what is normal temperature. So cold stress is if the hands and feet go immediately blue, and there is that means there is definitely a stress to the baby. The first time when the baby is born, that will be there. So don't be scared, because I told you there is temperature change. But if you later observe that, then you need to be worried. But otherwise, if your hands and feet are pink and warm in this weather, the body is warm, that means your baby is doing good. So the baby loses a lot of heat through some parts of the body, like the head. So we always advise you to cover the head, because the head of the baby is much larger than the body in proportion to our head and body ratio. So that's why babies have a lot of heat loss from the head. So if you cover the head adequately, you cover the palms and soles with mittens. So the temperature is mostly, we all cover the body, but these are parts which we normally ignore. So we need to make sure, even in the summers, if you have a slight cotton cap on the head, so even if your AC is on, it's fine, because at least it protects the head from any heat loss. Similarly, even if you see the temperature, sometimes if the baby has a fever also, the head is the warmest part of the body, because the head surface area is maximum. So it's very important to take care of the head. Again, like I said, we should adequately cover the baby, not in not layers of blankets, but we should cover the baby per se. Most important, and I will again be talking about it, is breastfeeding. So why are we so proactive about breastfeeding? So breastfeeding is, according to me, the best thing you can do for your baby and for yourself. You don't have to sterilize bottles. You don't have to buy formula milk, which is some powder. And you don't have to, get up in the middle of the night, get up out of your bed, make formula, feed the baby, wash the bottle, and always be scared whether there's a risk of infection. So if you can adequately feed the baby, there is nothing better than that. There are always hiccups. You may need to use 1 or 2 feeds of a formula in the first few days to tide over a crisis, but that's it. Don't, just keep your cool, and eventually, there's less than 1% of women who actually have a medical condition who would not be able to breastfeed the baby. If you want to, you can breastfeed your baby. There is really no way you cannot breastfeed your baby. So like for instance, for me, my second baby needed a little bit of formula in between. I weaned the baby off formula. So the first week or 10 days, I used 1 or 2 feeds. But don't get into the habit of relatives telling you that, give one formula, otherwise later the baby will not get used to the bottle. Or why do you want to spoil your sleep? Even if you give one formula feed, your body is perceiving it as less requirement of milk for the baby. So it will produce, yes.
Like people are, mostly relatives are like, you are not feeding enough.
Exactly. Yes. Yes.
So then you should just be formula.
Yes. So first of all, the baby loses weight in the first week of life. It is normal. 10% of weight loss happens to all babies. And then they regain that weight by 14 days or 2 to 3 weeks. That is the normal phenomena in all babies. I will tell you what adequacy, the next slide is about how do you decide adequacy of feeding, okay? So, the first 2-3 days or a week is the time where the body and the baby are establishing a bond. The more you suckle, Even if you have to give formula, suckle the baby first. So put the baby to the breast, let the baby attempt sucking, because that will tell your body that you need to produce milk. Or maybe you can try pumping, so that again that same signal goes to the mind. And then after a week, 10 days, there is a basically a milieu established where the body knows how much milk I have to produce. Some people can produce more milk, so they may actually leak milk. When you're feeding, you may leak milk from the other side, which happens initially commonly in the first month, and that is also normal. So relatives will always tell you ki your milk is not enough, but you have to trust, and you have to trust the doctor. If you have a doubt, go ask the doctor that I feel my milk is not enough. But the baby does not keep crying always because your milk is not enough. There may be hundreds other reasons why the baby may cry. You will not supplement anyways any honey, shahad chatana and all of that used to traditionally happen. Thank God we are saved. We will not advise it to the babies, because they can be life threatening diseases caused by honey. Okay, honey has some anaerobic bacteria which can cause life threatening diseases. So in the first year of life, we don't recommend honey. Okay, no glucose water. अगर किसी को कुछ करना है वो मम्मी को चटा दे, बच्चे को कुछ नहीं देना है. I mean that has to be your forte कि मतलब I am not going to let anybody give anything to my baby. You might have to have some opposition from relatives that but it's okay, it's worth it. Yeah.
Actually, I've heard this in my in-laws side only.
Sure.
But it's the first tradition when baby is born.
Yes.
We used to give honey to the baby.
Yes, it was, but you're not. I know, but you're not supposed to. You should be. It is so important. You can take. You can fight with them for this. It's worth that much, because of the fact that it is. Again, it's a risk of infection, and this infection that is caused by honey is life-threatening. So it may happen in 1 in a million, but you don't want to be that 1 in a million, right? So what I'm trying to say is that traditions are good. You can apply anything, but don't put it in the mouth. The baby's gut is really, really immature, and the baby's gut is not ready to handle all of that, right? So it's a small thing. Initially you will face a lot of these. I faced this as a pediatrician. I've been told, "ठीक है, you must be knowing scientific things, but we know traditions." But then you have to stand up for it. Some things you should stand up for, some things you should allow. There has to be a peace that you have to make, but saying that I'm not going to let you put anything in the mouth of the baby. Okay? That's why we emphasize about it. That's why we say exclusive breastfeeding, right?
Also emphasizing the first point, because you say within half an hour.
Yeah. So, yeah.
It doesn't happen.
So most of us, we even try and breastfeed the baby in the OT. If the baby is vigorous and the mother is ready, I have put the baby on the breast while the mother is under anesthesia. I mean, it's spinal, mother is awake. So, because once the baby, in a normal delivery, we feed on the table. So, in a normal delivery, it is recommended half an hour to 1 hour. In a cesarean, we say up to 3-4 hours, but at the earliest, give the baby the chance to get in touch with the breast of the mother, because the baby is hungry. The baby has those sucking movements. The moment the baby gets the breast, the baby will try and latch on. It's like a golden hour. We don't want to miss it if we can. However, if for any reason the mother is not up to it, or the baby is not, like I said, all these things should be done, but don't lose your sleep even if you deviate. All mothers want everything good for their child. But we try to do this. We try in the labor room. When we come for delivery, if the mother is up to it, we are very happy that the baby is given immediately to the mother. That skin to skin touch is very important for both the mother and the baby. And the mother's body also perceives it that, like I said, that I need to produce milk. So we do it. Within half an hour, we do it immediately. Okay. And like I said, if you have your cesarean, there is some effective anesthesia which may take a little while. So that needs to be taken care of. Colostrum is the first milk. It's normally thick, it's normally yellow. It is, some people will say it's not enough, but whatever it is very nutritious, and it should be given to the baby, okay, immediately. And some people previously used to say you discard it. It's not to be discarded. It is a storehouse of nutrition, so much so that colostrum is being sold it's been sold in the market. So it is so vital that you can't let it go. Normally we say feed the baby. A newborn normally asks for feed every 2 to 3 hours. And it should be on demand. Slowly you will realize some babies sleep after a bath for 4 hours. That's all right. So a baby establishes their own routine. But normally in the first week to months, they do ask for feeds every 2 to 3 hours. How do we assess adequacy of feeds? Very important. The child sleeps for about an hour or two after feeds. The baby passes urine. This is very important. We are not bothered about passage of stools. Traditionally, everybody in the family will say the child has not passed stools. The child has not passed stools. इसको constipation हो गई, ज़्यादा बार हो गया तो diarrhea हो गया. A breastfed baby can pass stools up to 7 times in a day to once in 7 days. Exclusively breastfed baby. Once in 7, 10 days also I have had babies passing stools. It's normal. We normally check for the thyroid function right now at birth for most babies. So thyroid is a common cause of constipation. Once that is ruled out, we have really nothing else to worry about. Nothing. So it's not related to mother's constipation at all. It's not related to mother's diet also.
I was asking if the mother has thyroid, then the chances of the child having it, and when you check.
So we check at birth.
Okay, check at birth.
Yes, most of you before discharge, yes, it's done for all of the babies in the hospital. So there's a blood test which you will be advised to do, which is called Bio 4 or Bio 7 depending on what you want. So we take a capillary blood from the baby. It's a very small amount of blood, and that tests for it's like a screening test for all the important diseases in the baby. Okay, and normally we do it before discharge. Sometimes we do a cord blood TSH also, which is not the best thing, but we do a Bio 4, Bio 7 for all patients in this hospital. Okay, for whoever is willing, like we tell you, but it should be done because yeah, obviously. No, it's on consent because there's a cost for it. That's why it's on consent. Otherwise, if it was free like other countries.
Some of the basic tests are already included
In the packages. So yeah, but when they're telling you the packages, they will tell you. So like I said, it's done for all babies practically. Even if you don't want it, we will probably convince you to get a thyroid. So we do it for all of them because we know it is very vital. Because for thyroid problems, why we want to pick them up early, because the treatment started early has excellent results. If for instance you are not treated, you delayed the treatment of thyroid, then your baby can have long-term problems. So we don't want that. So there are certain diseases which we want to be picked up at birth if we can. So, and there's no other way you can pick it up. So urine is very, very important. Urine is like a gold standard for the wellness of the baby, because a normal baby who's well fed will at least have passed urine 6 times, and most of our babies are in diapers. So that's a little worrisome because parents sometimes don't even realize that how many till the diaper is really full. जिसमें 2-3 बार ये हो चुका होगा, and the parents will not know that कितनी बार हुआ. But fine, if you have 4-5 diapers in a day which are full, it's okay, right? Golden yellow stools are traditional breastfed baby stools, but they take about some time to have traditionally golden yellow stools. Okay, so another thing is let down reflex. Like I said, when you're feeding the baby from one side, the other side may start leaking. That's also a sign of good milk production and a good weight gain. So the first week 10 days we don't expect a weight gain, but beyond that there is a good weight gain that we expect. So this is the stool color. At birth you have what is called as meconium or black stools. Okay, that is the normal color of stool at birth. So don't worry if you see this first or second day. Then it becomes a little greenish, and then we go on to the breastfed stools. What is a gastrocolic reflex? Some parents will say the moment I feed the baby poops. Okay, that's a very common problem. The moment I feed, after every, so usko to digest hi nahi hua. That is not failure of digestion. It is just that the baby, while the baby feeds, there's a reflex and the baby passes too. So that's called a gastrocolic reflex. It's normal. If your baby is otherwise gaining weight, passing urine normally, even if the baby is pooping, like I said, 7 times, 10 times, it's okay. If it's small amount, If it's watery, if the urine is less, if there's anything else, then it's a diarrhea. Again, if you're breastfeeding your baby, your chances of infection are so less that it's not funny how much you eliminate the risk of infection. Though we are so proactive in sterilizing our bottles or whatever, but still nothing better than the breast. Urine, I said, is very, very important. At least 6 to 8 times a day. It tells us the adequacy of the feeding. Sometimes there can be some crystallization like pink urine in diapers, which is also considered normal. So don't worry if you see that. How do you care for the bottom of the baby? It's very important. Like, people are worried about diaper rash. It's a common problem. So why do you have diaper rash? You have diaper rash because if you keep moisture, if you leave it wet for a while with the plastic, you are obviously bound to develop some rashes. So you're not supposed to rub the perineal area, you're supposed to dab it. In summers you can air dry it. You don't need to like rub it. You can apply some creams which have zinc oxide, the diaper rash creams. These creams, especially if you know you're traveling for a long time, so you apply it and then put the diaper. If you're changing the diaper frequently, you don't normally routinely need it. In winters, obviously at night, make sure you change the diapers often. Sometimes we tend to sleep off. Just be a little careful about that. What kind of diaper should we use? Should we use a cloth diaper? Should we use a disposable diaper? What should be our choice of diapers? Up to you. There's nothing wrong in using a disposable diaper. If you want, some people use cloth in the day, disposable at night, whatever suits you. What are the pros and cons of a cloth diaper? It's soft, it's reusable, it's washable, it may leak. Nowadays, though, you get some diapers, if you visited any of these websites, First Cry and all of those, which are like proper disposable diapers, and they have inserts, cloth inserts. So they don't leak as much and they are good. Maybe you have an issue while traveling, but at home I think it's not a bad option. A disposable diaper is, of course, they're convenient, but then it's plastic and all of those things, and there is a little probably higher chance of diaper rash because you're more comfortable using it longer. As a cloth diaper, the moment it gets wet, you will remove it. But if it's a disposable diaper, we tend to use it longer, so the risk of a rash may be more because of that. Otherwise, there's really no reason. There are some things which you should be careful when you change a diaper, especially in girls. Normally, we will pick the bum up and clean from front to back. In girls, you never clean from front to back because you will be transmitting the fecal particles to the front, and the girls might end up with a urinary infection. So you're always supposed to clean from the front to the back, not from the back to the front. That's something that you need to be very careful with girls. And how tight or how loose should the diaper be? You should be able to place 2 fingers between the diaper and the baby's abdomen. When there's a cord, the babies all have a little umbilical cord or stump, which I will show you. So when you have the cord, you make sure that the diaper does not touch the cord. Just fold it below the cord, and that is only in the first week, 10 days again. So it's not something to worry about. How do you care for the cord? It normally falls in most babies by a week. So we apply a little clip there, if you see in that picture. That clip is plastic. The cord, once we cut the cord is not viable. That's why it falls off. There is no blood supply in the cord. So that plastic doesn't really hurt the baby. It's just there as a clamp. And don't put any Dettol. Dettol actually is, a lot of people used to wash the clothes, put them in Dettol. Don't do that. Dettol is not good for baby skin. You don't need to do that. You need to air dry in the sun. If you get good sun and you are able to dry the baby's clothes out in the sun, sunlight is the best thing that can happen to the clothes as a disinfectant. You don't need to put the clothes in. Rather, some people end up with rashes and reactions to Dettol. So, yes.
Like we buy a new clothes for
Yes.
So for the child,
Yeah. Yeah.
we used to Dettol.
No Dettol. No Dettol. Just take any baby detergent. Any baby detergent.
You need a softener also, that's only for winter.
Not really, plus minus. So, you don't need to use too much detergent for a baby cloth. You just need to use a little bit of detergent, wash it and dry it in the sun. So sun drying is very good. Please don't use Dettol. Okay.
What is the ghee for?
So some people use ghee to that umbilical cord base. and they use Savlon and they use Dettol. Don't do all of that. If you really want to clean it, normal boiled cooled water, or we get alcohol swabs. So all that, you don't need to use anything.
You're not supposed to clean it anymore.
It has to be clean and dry. It has to be kept clean and dry. Sometimes there may be a little discharge which you can just clean with boiled and cooled water. So sterile water or a swab. You don't need to put any of these things. Okay. When you worry is when you see like an abdomen which is distended. If you see some redness around the cord base and swelling. Otherwise it's fine. A little discharge, a little discoloration, is okay. Okay, because the base may be a little black when it's drying and then it goes off in a few days. But if you see that the child is not comfortable, the abdomen is distended, there is some local redness, then of course you need to worry about it. Otherwise you can just leave it alone. So most of the things in a normal baby can be left alone, but you need to know when do you need to leave it alone. So another very commonly asked question is, when is the first bath? So you can start sponging the baby, but the bath, or when you dip the baby in the water, should be preferably done once the cord falls. Okay, once the cord falls, it's easier also to give the bath. You can just make sure there are baby tubs, everything, and you need to keep the head supported, because obviously the baby can't support the head, and then you can immerse the body in the water. Traditionally, ideally, there should be no cosmetics used till 1 month at least. Okay, and nowadays the products that we suggest for a baby bath are normally non-cosmetic. Somehow we've gone off Johnson's, not that I have any personal interest or personal this thing with Johnson's, but the point is that the products change the pH of the skin. So it's not very baby friendly. So there are other companies which we do advise, which you would all have heard also, Sebamed and Aveeno and all of that. And those are much more baby friendly product. Also, you don't need a lot of products. You just need a little bit of the product.
There are 5 products for every part.
I'm sorry. You don't need like 5.
Yeah, one
So,
for every part.
no. So you can take a baby wash and a baby cream, which is good enough. You don't need to use talcum powders. No talcum powders for babies at all. Don't buy a talcum powder. You don't need to put talcum in the diaper area, जैसे पहले डालते थे, because what you do with the talcum is you block the pores. You block the pores, that acts as an eye, and you're putting moisture on it, so you will have a diaper rash. So no talcums on any part of the skin. Okay, you need to use creams though for moisturizing the skin, because baby's skin is very, very sensitive and it needs moisture. Okay, some children, especially if the parents have a history of some allergies or dryness, may need more moisturizer. So you would need creams, but you definitely don't need talcum. Okay, and again, something that we lose our sleep over is massage. It is very scientific. It is a good cultural practice. It improves the circulation, the tone. However, you don't need to be vigorous. Like previously, Abhi, there are a lot of places where you have these ladies coming in who give your baby a rigorous massage, and then we end up with babies who have a shoulder which has come out. And I'm not joking. We have babies who come in with trauma because of massages, or somebody has pulled the penile skin back so hard that it gets injured. So I think traditionally the mother and the grandmother or whoever is with the baby can give a gentle stroking massage to the baby. It improves your bonding, it improves your time with the baby, and that what you can do for your baby, nobody can do, trust me. Nobody can do it. Other than the mother and the grandmother, there is no nanny who can come in and do a better job than you. So it has to be gentle. It's just supposed to be, you give a little exercise, you talk to the baby, you interact with the baby. So it's like a bonding time. And obviously once the baby takes a shower after that, the whole exercise is comforting for the baby.
Usually, can you also bathe them first, then give them massage?
Oil should not be kept on the body. Then you need to massage with cream. Okay, because again, like I said, oil can also block the pores. So people in India, we are very fond of oil also.
Especially olive oil.
So extra virgin olive oil, let me add to that. So, even like we traditionally oil our hair and then we have dandruff, so you're not supposed to use oil if you have dandruff. Oil is very bad for your scalp if you have dandruff. हमें लगता है वो dryness है, but it is. You will use oil. I'm coming to that, but I'm saying don't keep the oil. If you oil, then you bathe. If you want to massage after a bath, then you use cream. Then you don't use oil. Okay, because cream can be left on the skin. Oil should not be left on the skin. Which oil is again something हमने यहाँ से oil मंगवाया, वहाँ से oil मंगवाया. Anything that can be eaten can be applied, other than mustard oil. Mustard oil is very irritating to the skin, especially to the baby's skin. So don't use mustard oil. You can use normal coconut oil. I've seen coconut oil works wonders for most baby skins. Okay, olive oil, okay, fine. Any of these other company baby oils are fine. All these baby product companies. So I normally have seen most skins which are irritated do very well with coconut oil. So that is, and the baby absorbs the oil through the skin. Unlike us, our skin is so thick, we won't absorb the oil. For babies, they can gain weight with the oil that you absorb on their you put on their body. So that's why we say whatever you can eat, you can apply. So don't go for anything very fancy or anything. An extra virgin coconut oil is fine, according to me. And ये तो जो बोलते हैं उनसे पूछो, but ऐसा कुछ नहीं होता. So you'll hear a lot of this. ठंड लगती है इससे, गर्मी लगती है उससे. This is just the starting of your journey of ठंड and गर्मी. So some things I believe do have a scientific basis, but then most of, it's like there are a lot of scientific things, but there's nothing scientific to ठंड लगना with coconut oil. Entire South India uses coconut oil. किसी को ठंड नहीं लगती है. Like I walked a lot down south. वहाँ पे बोलते हैं आटा खाओगे तो बीमार हो जाएंगे. यहाँ पे बोलेंगे चावल खाओगे तो बीमार हो जाएंगे. So it's more what is available locally. I think what is processed locally, that's your staple food. So you just rely on that.
Why don't you not use mustard oil?
It's irritant. It stings. Even if you apply it and if you realize if you have a little dry skin, it stinks. So you don't want the baby to feel that stinging sensation. That's why you don't use mustard. There's nothing really otherwise to it. The timing and the place of massage, ideally before a bath. The room, it's like you have that sunlight coming in, so that area might be you shouldn't have a lot of a cold area. In the winters, maybe you can preheat the room a bit if you want, and otherwise it's okay. In the sunny weather like this, you can give the massage to the baby. The time can be decided with whatever is comfortable with the baby and the mother. You will figure it out. Normally we start with 5, 7, 10 minutes. Once the baby grows older, you're even okay, and it's sunny, you are okay with leaving the baby sunbathing, with the. So they're not ideally supposed to be put under direct sunlight. I'm coming to that also, because that can be harmful. So we don't, like earlier we used to say बच्चे yellow है तो sun के नीचे रख दो. No, that is a very bad practice, because the baby becomes dehydrated and there is no benefit from the sun rays. So only you might need the sun for a little warmth, but you don't need to put the baby in the sun directly. There is enough vitamin D otherwise also. We supplement vitamin D to all your babies from birth, because mother's milk though has vitamin D, still it is not enough. So we supplement all breastfed babies from birth with vitamin D. So don't worry about vitamin D. Okay. Something for all those who have girls, please don't apply kajal. Some people think it's very beautiful, but your girls are anyways beautiful. Or anything, like I said, you apply may have a risk of infection. So think about that before. Again, it's a tradition in some households where they apply a thick layer of kajal. No ways. So tell them it can cause infection, it can cause conjunctivitis, it can cause so many things. Sometimes you will see, again it's a very common problem, that the babies have watering from the eyes. Okay, that's because we have a duct here which is called the nasolacrimal duct, which is blocked in. It's a very thin duct in babies, so their secretions don't get cleared out. So we will teach you a little bit of massage here for the duct. Okay, and if you apply kajal, again you're blocking that duct, so you don't want all of that. Okay, so the less things you do, the less adventurous you are, the better it is. Another thing that a lot of people come and ask, it sounds funny right now, but either they will say कि मेरी बेटी के सर पे बाल नहीं है, या फिर body पे बहुत बाल है. No, it's not funny. People come and ask me, can we bleach? Can we remove this hair? So baby hair goes away by maximum by 1.5 years. Okay, there's a lot of changes that happen. If your girl doesn't have hair, she will get hair. The body hair goes away. Preterm babies have more hair than term babies, so that's also a mechanism of protection of the body, you know. So let it be. Okay, don't do anything, and no atta. Some dadis and all will say atta laga do and besan laga do and all. Don't do all of that. Huh? Atta se? Not in a newborn. Don't do all of those things in the early months of life, because the skin is very, very yes. So you will cause more of a dermatitis and a reaction to the baby, rather than, see, when you're not giving the baby anything orally for 6 months, you're not, other than breast milk, you don't need to even apply anything else. So no, none of that. Not at least till the first 6 months of life. Okay. Another thing that I really emphasize on is hygiene. You should have minimal handlers of the baby. You know, you can choose. The mother, of course, can do anything, and whoever, say the grandmother, you might have to say that, you know, to relatives, my baby is sleeping, sorry, you can just see and go. But the point is, don't give your baby around to everybody, with everybody kissing the baby, because you transmit so many infections by kissing, you know. So in the winters we have the whole of this flu season. In the summers we have all of these mosquitoes. So you know, it's a good idea to wrap your baby, put the baby to sleep in a mosquito net, and say, you can watch my baby from a distance. So best is nets. Physical measures are the best. Anyways, if you're covering your baby fully, only thing left is the face. So make sure you use a net. For the younger babies, that is the best thing. You get nets for a cot, you get nets for a stroller, you get nets for everything. So that way you don't apply anything on the skin, and that is the foolproof method. You know, you can ensure that your room is clear of mosquitoes, and when you're cleaning one room, you make sure the baby is in the other, and then you can use these nets. Okay, so make sure that, of course, the mother has full right to kiss the baby, but don't.
Summers में जैसे हम लोग liquid use करते हैं, is it good for the baby?
Not really, not.
Babies also.
So the best is you have physical nets for the baby. Okay. Some people are worried about discharge. The girls may have vaginal discharge like bleeding, which is also normal. This is because the mother's hormones are withdrawn. So some girls may have bleeding like menstrual bleeding, but it's normal. However, go check with your doctor, but don't panic. You know, sometimes it happens in the middle of the night and you are like, you sit up and you don't know what to do, and then you read Google and you get hundreds of other things. So don't panic. The idea is, if your baby is active, your baby is feeding well, your baby is passing urine, don't panic. Okay. So it is all normal. Sometimes there may be a little breast enlargement which you see. Don't sit and express milk from that breast. Again, that's because the mother's hormones passed on to the baby. So, you know, some grandmothers will say, you need to express that milk, this is a witch milk and this and that. There's nothing like that. So most of these things settle in time. So most of the normal newborn things settle in time. Sleep, you cannot immediately set the sleep of your baby. Sleep with the baby. Sleep when the baby sleeps. Get up when the baby. And you need to be in rhythm with the baby. You don't know, you know, some people will say, you know what, मैंने अपने बच्चे को sleep train कर दिया 6 weeks. And then you're like, why am I not the perfect mother? Trust me, everybody does their best. There is no way you can sleep. You can try. You can try by establishing a day-night cycle. The day the sun is out, the night you dim the lights, you play lullabies. So you can try establishing sleep routines, but there is really no win-win situation that you get. Initially, try and sleep as much as you can with the baby, and don't worry about who comes and goes. Okay, otherwise you'll become a zombie. My baby cries a lot. Why does my baby cry a lot? Some babies cry. And ask me as a pediatrician, if you come to me with a crying baby, I'm very happy. That means my baby is fit and fine. Okay, if the baby is dull, I'm not happy. So crying can be because of hunger, it can be if the baby is wet, it can be if the baby is hot, it can be if the baby has a nasal block. So once, I'll tell you, we had a baby who came in about 6-8 months. Baby was crying. We did everything we could. We did not feel like doing a lot of invasive things because the baby was looking fine. And finally we looked everywhere for some bite, something, we undressed the baby. The last thing we figured was there was a bug in the ear. So a cry is all the baby can do. So don't panic, like wait it out, try and figure it out. And the last thing that I've written is colic, which scares most parents. Some babies are more colicky than others. Colic is a very unique thing. It happens, you can't see? Fracture clavicle. So again, like, sometimes massaging and all, they can end up, so any injury anywhere, basically, which happens less in our scenario, but it does happen. It's also it's something we see, so what is colic? Why do we lose our sleep? It happens more commonly in the first 3 to 4 months of life. It occurs because of gas, like gas, because babies cannot either fart properly or burp properly, so they tend to retain it and then they feel irritated. It is a little more with bottle-fed babies than breastfed babies, but it's not that breastfed babies cannot be colicky. Some of them can be really bad, and it traditionally occurs in the evening or night. So you lose your sleep most of the time, or dad comes home very happy, wants to meet the baby, and he's like, why is my baby crying? All through the day the baby will be fine, and most of them settle on their own. So you may put the baby on the tummy, give tummy time. You can massage something on the navel. Don't give anything orally. No soft pani, no elaichi pani, no ajwain, nothing. We can give you some drops if need be, but that should be suggested by your doctor when you see the doctor. Okay, and sometimes it just gets okay when you take the baby for a drive. You don't know why. Maybe that whole change of scenario. So what can you do is you can massage. You can lay the baby back on the stomach. You can put some music, that helps. You can take the baby for a drive. Sometimes they come. हम तो निकले थे 4 घंटे से रो रहा था. यहाँ पे आके तो ठीक हो गया. क्यों ठीक हो गया? Nobody knows क्यों ठीक हो गया. Probably the baby just released the discomfort. And so if medication is needed, we will tell you. And it is not related to the mother's diet. 90% of the times you will hear one or the other relative telling you, तुमने आज राजमा खा लिए, बस. तुमने आज छोले खा लिए, आज तो गोभी खा ली कच्ची, ये खा लिया, वो खा लिया. So if you ask what is written in the books, it says there are some foods like cabbages, like tomatoes, which can cause, increase in acidity, but not rajma and chole. See, if you are comfortable eating a food, you can eat it. Everything in moderation is good. Obviously, if you eat only rajma and chole, you only will not feel good. So make sure you have a healthy, balanced diet. You don't need to have excess of those laddus and those pinnies. You need one extra meal. So you have to eat one extra meal because you need those 400 calories extra, but that doesn't need to come from pure ghee. Okay, so don't oppose your family members saying ki ghee kha lo, but try and strike a balance. Maybe you can take 2 laddus, sneak one to your husband. That's between the two of you, but you need to balance it out. So you need to have a balanced diet. If you have one extra meal of roti, dal, sabji, that's good. Okay, and the mother's health is not related to the baby's condition. The baby is a parasite. If the mother even is, so even in the lower socioeconomic strata, the mother is producing enough and good milk for the baby. So there is really no way that you do wrong to your baby. Whatever it is, if you're not well, even if the mother has a cold, the mother is passing on antibodies also to the baby through the milk. The mother might give the infection, but the mother will also pass the antibodies. So that cold that the mother has might be protective to the baby in the long run. So there is no way the mother can do anything wrong. Beware fathers, but the mother is always right. And you need to be really, really positive because like it was previously said, whatever you think, the same thing you pass on. So if you have negative, if you think, मैं नहीं कर सकती, मुझसे नहीं हो रहा, मेरे साथ, I'm not getting milk, oh, why am I not getting milk? So even if you're not getting milk, relax. Take a break, go out, breathe, take a walk, do anything, but just relax. If you don't relax, then there is no way that, the things will be fine. So, and the first week, 10 days, a month are very crucial. We all grow through a lot, whether we are doctors, whether we are gynecologists or whatever, we all of us, when the baby comes, it is a very it's like a miracle baby. Very rightly said, it's a situation that is not very easy on us, because you have another life to be responsible for. So you suddenly, that gush of responsibility gives you a, it's very difficult. So try taking out some time for yourself also, hand of the baby, or leave the baby when the baby is sleeping. Sometimes you even get negative thoughts, like, why did I get into this? It's all normal, we all go through it, because it is too much of work. But then have faith, keep your cool, and all those faith. That's why you have books, that's why you have literature, that's why you have, so you can read a book while breastfeeding, maybe that gets you through it. You can watch a video, though of course now there are studies even on the fact that when you breastfeed, you should concentrate on the act of breastfeeding, because when you are breastfeeding, you are again establishing a bond. So that's a very, but trust me, the amount you need to breastfeed in the first 6 months is not funny. You sometimes do get bugged. You are like, oh my god, don't I have anything else to do in this world? But then okay, again, it's a phase. You need to be really, really patient. Okay, so it goes away. So whenever you feel the fact that I should leave it right now, think that it's a phase. The next 3 months, and once your baby grows up, the baby is not going to come and cling to you. Once they are 5, 6, 7, 8 years old, they'll be like, please, I have to go with my friends. So enjoy it while it lasts. It lasts, and just enjoy it. Another very common problem is a nasal block, sometimes in babies, because their nose is very narrow. So again, they don't need a lot of medication. We give you some saline drops, some steam. Babies do become yellow routinely. It's a common phenomena, and it's physiological. Physiological means it's normal. Some babies may need phototherapy because of some blood group setting or some other issues, but don't place the baby under sunlight.
But
So
this you find out at birth, or
no,
it develops later on?
it doesn't happen in the first 24 hours normally. If it's happening in the first 24 hours, it's a bigger problem. It happens on the second or third day when you're going home. So normally you are called back after 2-3 days, and you're advised to look for it. The face normally looks more yellow than the body. That's why it's more visible also. So we will tell you, depending on the situation, on how to monitor your baby and when to come back.
What do you say about the sun?
Don't put the baby under the sun, is what I was saying.
In this condition or
In any condition.
why do they keep baby for 2 hours in the sun?
I don't know. I said ask them who do. But in the first few days, no, at all. Because, the first 2-3 days, the baby is at a very high risk of dehydration. You're establishing the milk supply. The baby is losing a lot of heat because the baby is just come new into the environment, and lots of heat loss is happening because of the fact that the baby has to adjust to the outside temperature. On top of that, you put the baby under the sun, so you're gone. We have babies coming to us with dehydration because of that. So we don't advise you putting the baby under sunlight. And again, it's got nothing to do with the diet. There are some danger signs, however, which will need to be kept in mind. If your baby is lethargic or dull and not sucking that well, okay. If the baby is a little irritable because of a nasal block and not feeding well, it's okay. But if the baby is dull, not able to suckle, or you feel that your suck is not good enough, if the baby appears cold and blue, vomiting, again, normal babies can vomit curdled milk. That is normal, okay. If, however, you see greenish vomiting with the stomach being distended, worry about it. If you see any, normal babies breathe faster than us, but if you see that the chest wall is going in, or you see any difficulty or labored breathing, you need to worry. Not passing urine is the most worrisome thing for most of us, especially for 12 hours, and along with not feeding well. Any abnormal movement, sometimes like seizures, sudden stoppage of breathing, of course. Unusual change in the baby's behavior. Mothers are the best judge of the baby, because you stay with the baby 24 hours. So if you feel that there's excessive, like the baby is not arousable or excessively irritable and not feeding, then it may be a good idea to get to your doctor once, just for a check. So these are just some of the things. Out of all these, I will give most credence to not passing urine and a greenish colored vomiting with abdominal distension, because sometimes most of you will realize that the babies do vomit and you come rushing to your doctor, but this is one condition where you should come, okay. Some babies have birthmarks, which are again normal. They may be there on the face, buttocks, limbs, and most of them fade by age. Some of them develop later and may persist for life. So if you have a doubt, you ask. There's something called Mongolian spots, which are seen on the buttocks. I think it's also clear. They're bluish spots you might have seen on the baby's buttocks. Most of them pass off by about 1 to 2 years, and sometimes they have little reddish patches on the forehead. That is normal. They also disappear by 2 years. They are just more vessels. A lot of times we have people coming and telling us, please give me some medication, like this bleeding thing I told you, the bloody discharge per vagina. I had one grandmother who said, दवाई दो आप. मैंने कहा मेरे को दवाई है ही नहीं, कहाँ से दूँ? What should I give? You know, you can go to anybody else, but there is no medication for the problem. So most of these things settle off on their own, and that is good. The less we medicate the baby, the better it is. You know, it's not that we don't want to medicate. Most of these are self-limiting issues, so you don't want to medicate. What you need is TLC. TLC is tender love and care. Okay, so that's all you need most of the times.
Rashes that keep appearing and then people speak out.
Where?
On the face.
So face, most of them are again normal. Some of them very rarely need treatment. So again on the face we call it erythema toxicum and other things, and they are normal. Then again they are more in the first week of life, and because they are on the face, everybody can see them. So everybody will say ye kya ho gaya. But then let your doctor decide ki ye kya ho gaya. And again most of them are normal. Okay. So again we don't want to put steroids or anything just because, you know, it looks bad. There are no magic medications to make the baby fat. Even later, a lot of people will say, ये मोटा कर दो मेरे पास एक बारी, with all due respect, एक बारी एक दादी जी आके कहती है, इसके मुंडन है, इसको मुंडन पार्टी तक मोटा कर दो. मैंने कहा अगर मैं आपके बच्चे को कर सकती तो मैं अपने को भी कर देती. But I'm sorry, हमारे ना पंजाबी हाउस होल्ड में ऐसा होता है कि पहले हम खिला के बच्चे को मोटा करते, फिर भगा के शादी के टाइम पे पतला करते. So that's not right. You want a healthy, active baby. You don't want a baby. You will not. And it's not that you want to compare, but you know, when your baby grows, you have a tendency कि yeah, this baby is my baby's age. Why is the baby smaller, or my baby smaller, or why is that baby fatter? And so don't do that. Every child, even between your own two kids, you will see that we have this tendency of saying, तेरा भाई तो बहुत खाता है, या तू तो, you know, it's just how we are. But just try not doing that. If your baby is active, if your baby is able to run around, is you know, doing everything fine. Every child eats differently. One child may want food every 2 hours. One child will be happy for 4-5 hours. So just don't run around your child with food. We need to establish healthy feeding practices with our children. And it starts from breastfeeding. That's why breastfeeding on demand. Some people will wake up the baby every 1.5 hours and feed. That is not needed. So these are healthy practices with food. Most of us also don't have healthy practices with food, and we need to establish those. And like very rightly it was said, you know, when you become pregnant, there are so many things you suddenly start paying attention to which you would have never done before. For instance, you know, maybe your consumption of alcohol. I mean, it might just be normal for most of us, but you will think about it twice, you know, at least you will think. You will think, wahan pollution hai, subah sham, should I go? Or, you know, that I shouldn't be doing this, I shouldn't be doing. So there are a lot of things that you think. You know, ever since I have kids, I'm thinking whether India is a clean enough country to stay in, which I never thought about before. So there are small, or should I not use so much plastic because the future generations will be affected. There are a lot of things you think, which is good, because we're thinking as a society, we're thinking for the betterment of our child. So just be, you know, cool. Of course, is that you can voice your concerns. We all have concerns, and they should be properly and scientifically voiced. But don't get into this. There are no things which will increase your immunity. I have seen kids who will eat everything. सारे दिन बादाम खाएंगे, सब कुछ खाएंगे, but फिर भी बीमार पड़ते रहेंगे. और कुछ जो कुछ नहीं खाएंगे, फिर भी उनको कुछ नहीं होता. So it's just, and they do fall sick. Children do fall sick more than us because they are building their immunity. Every attack of cold and cough is giving them resistance to that virus or that bacteria. So it's normal, you know, whatever you do. And children play everywhere. They're not like us ki sara din hum haath dhote rahenge. Another thing I wanted to emphasize, I think I didn't, is our home environment. So, you know, we'll keep sanitizer. जो आए पहले sanitizer use करे और फिर बच्चे को हाथ लगाए. So get over sanitizers, wash your hands. Use sanitizers only when you're traveling. Okay, they are overrated. Again, they are chemicals. Nothing like soap and water. So anybody, rather even for the mother, I would say, if you can, every time you touch the baby, make sure you wash your hands and pick up the baby. Nothing like soap and water. Okay, sanitizers are overrated and highly overrated. Oh, it's okay to use them in the hospital setting or when you're traveling, but not. It's established even in the hospital setting. So when we go into our nurseries, each baby that we touch, we wash our hands, then touch the next baby, then wash our hands, because that is the best way to. And washing just doesn't mean putting your hands under the water, it means washing each and every part of your hand. Okay, so your home environment is very important. Of course, you can do up the nursery, but initially your baby will not appreciate anything. Baby can only see black and white. So if you put black and white, the baby can see. Otherwise, the baby will not be able to see anything. Even a human face, your face initially will just be like a round to the baby. The perception comes around 2 months. The mother, the understanding is different. Each mother and baby is like a lock and key, you know. You are made for each other. You're custom made. So the baby knows the mother by a lot of cues. It's not like the baby is seeing you and the baby is identifying you. So just be, you know, have a very comfortable home environment. There should be nobody smoking in and around the house, because like I said, you change with your baby. And you don't really need sunscreens for a baby less than 6 months of age. You can cover, you know, the baby's head. Sometimes I get funny questions like this: when can I see movies? When can I see Agnipath? So sound, you know, you make sure that the baby's ears are very sensitive. So don't expose the baby to loud sound. Even though your baby might be sleeping through the movie hall, it's not a great idea. Okay, sound levels are not good for infants. Yes. So again, you will feel the body is warmer, the baby will be crying and irritable. You can remove a layer and you will know. Normally for dressing, we say 1 layer more than what you are wearing is what is needed for the baby. So you don't need to like keep on layering the baby. And it does happen in winters. Just a word on baby vaccination. It's very important to prevent against 12 major childhood diseases. At birth, before discharge, we give you the basic vaccinations: BCG, hepatitis B and OPV. This is something we will keep on emphasizing afterwards. A very, very important final thought: our responsibility towards breastfeeding remains with us from birth to early months, and the fruits of our labor may be seen for many years after. So I cannot emphasize the importance of breastfeeding. And like I said, your lock and key mechanism is only your unique mechanism, and nobody can replicate it or reproduce it. So enjoy it as much as you can do. Don't be guilty. Everybody has their own situations, their own limitations, but whenever you do it, whenever you do it happily. You know, don't be burdened about it. And most of us can do it. Most of us should do it, because that is the best thing that you can do. Rather than giving, you know, a better room or whatever, the best thing you can do is breastfeed your baby. The take home message is be happy. Be happy through these 9 months, and of course once your baby's around, be positive. Most of these things, like I told you, they just pass. Even if you've not slept in the first month of life, you will eventually sleep. So we all go through it, and just make sure that that positivity radiates, because that is what you're going to pass on to your baby, and that's all.
अभी सबको याद है last time मैंने कौन सा बोला था, the best gift that you should be giving to your baby? क्या है? अभी देखो क्लास की टीचर को लेना चाहिए ना एग्जाम में, नहीं तो फिर फ़ायदा है क्या होगा, नहीं तो रहेगा. बताओ भाई, देखिए कौन बताता है. कुछ तो नहीं आए, पर जो आए हैं. Best gift which a parent can give to the baby. The best gift that all of you as parents can give is that you have to keep telling your baby you are wanted. You know, there is a lot of rejection going on in the society today. We may be rejecting at the first time when we see our urine pregnancy test. Some may be waiting, but some may be, and if I can do it, anybody can do it. Because I had quite a lot of medical knowledge when I did this. So anybody can do it. That want, ki we love you, we accept you, we are waiting for you, we were wanting to have you in our lives. That if you can give, everything will keep on connecting in that puzzle on its own. Sab baki apne aap beautifully hoga. वो लॉक इन की मैकेनिज्म भी अपने आप तभी चलेगा, नंबर तो याद होना चाहिए ना मेन क्या है उसका, तो इसीलिए वेरी वेरी इंपॉर्टेंट. सो आई थॉट टुडे इफ यू टॉक अबाउट द बेबी केयर, because there are so many things which your mind will unnecessarily create anxieties, so ये वाली चीज़ें you will remember, and we are all there to always support you and help you, but this gives you an overview of caring for your baby. And there are many things that we will talk about in the next class. I will talk to you about them. They are also relating to your post delivery phase, in which there is something. Did she talk about sacred hour? No, that I will talk, because as doctors we sometimes forget those basic emotional connects. So we'll talk about that sacred hour. We'll talk about how do you take care of you being a new mother, what are the fears and anxieties of a new mother that you need to face, and how confidently you tackle that, what are the fruits you are going to get out of it. Okay, and Savita will be talking about diet to you. So Savita is our dietitian, she is a part of our team, and she will be telling you, because there are many myths which keep circulating about diet also. दो चीज़ें डिलीवरी के बाद सबसे ज़्यादा टॉपिक होता है, एक बच्चे का पेट नहीं भर रहा, एक मदर को खाना क्या देना है. दोनों की डाइट पे ही कहानी चल रही होती है ऑल द टाइम, बिकॉज अब डिलीवरी तो हो गई, वो पार्ट तो डन है. तो अब ये एक चीज़ हमने अभी सेटल करी और अगले क्लास तक बिल्कुल परफेक्ट हो जाएगी, बिकॉज आई विल गिव यू इंस्टेंसेस ऑफ पीपल हाउ दे हैव ब्रेस्ट फीड. इट्स नॉट अ जोक. आई मीन आई मेट दोज पीपल, इट वॉज शॉकिंग फॉर मी कि ऐसा भी हो सकता है. एज अ डॉक्टर एटलीस्ट आई डिडंट नो. So we'll talk about that part also, but today let's talk to Savita about the diet part. So whatever queries you have during pregnancy, after pregnancy, she will sort out, and she's always there. And next time I will talk about this thing, and we'll also let our physiotherapist tell you a few things. And I think then जिन्होंने सारी attend करी हैं fine, otherwise then again we'll restart the next schedule. So we finally finished 9 classes, and from now on we keep putting them on the YouTube, so anytime you can go and look back. Okay, come Savita. And अभी आपको कुछ इनको खाने के लिए ना थोड़े बात
कर देते हैं 10-15 मिनट.
हाँ, तो आप बात करो जब तक वो आएंगे तब तक.
Hello everyone, myself Savita. So today we are discussing about diet during the pregnancy and after pregnancy. सो राइट नाउ किसी के कोई मैथ्स हैं, कुछ हैं, क्वेश्चंस हैं, सो अभी आप पुट अप कर सकते हो डाइट को लेके. बिकॉज ड्यूरिंग द प्रेगनेंसी वी आर फेसिंग कि हमें ये नहीं खाना, वो नहीं खाना, मदर इन लॉज मना कर देती हैं कि नहीं घी खाओ. एक तो सबसे बड़ा होता है कि घी खाना. एक मैंने सबसे मतलब मेरी मदर इन लॉ भी मुझे फोर्स करती हैं, लास्ट जो ट्राइमेस्टर होता है उसमें आपको घी पिलाने वाला सबसे बड़ा मिथ होता है. बट नहीं, दूध में डाल के घी पिलाना चाहिए, बट वो सबसे बड़ा मिथ है, वो नहीं पीना चाहिए घी. नॉर्मल डिलीवरी स्मूथ हो जाएगी, नहीं, बट वो लास्ट में क्या होता है, हम ज़्यादा फैट है वो वजाइना के नीचे डिपॉजिट हो जाता है, जो कि नॉर्मल डिलीवरी में फिर कॉम्प्लिकेशंस हो जाते हैं, बच्चे का जो हेड है वो नहीं निकल पाता है. सो बेसिकली हमें वो चीज़ नहीं फेस करनी चाहिए. पहले क्या होता था, वर्कआउट करती थी मदर इन लॉज वगैरह, बहुत काम करती थी, खेतों में काम, घर में इतना काम, बट आजकल हम लोग नहीं कर पाते ना इतना काम. सो फैट जो है वो डिज़ोल्व हो जाता था, बट आजकल क्या वो डिपॉजिट होता जाता है, हम लोग ज़्यादातर रेस्टिंग मोड में ही होते हैं. सो वो नहीं करना चाहिए. वो पहले के फेस में और अब के फेस में बहुत डिफरेंस है. ठीक है, अगर आप बेसिकली हमें जो है फैट का हम लोग बोलते हैं कि हमें कैलोरीज जो ज़्यादा से ज़्यादा हम फैट के थ्रू ही लेते हैं, बट ओमेगा 3 एंड ओमेगा 6 का कॉम्बिनेशन हमें लेना चाहिए. सैचुरेटेड फैट इज़ ऑल्सो गुड, बट लाइक हमें जो है ओमेगा 3 में लाइक हम लोग प्रेफर करते हैं कि नट्स यू कैन प्रेफर, सीड्स यू कैन हैव, दीज आर ओमेगा 3 रिच. ठीक है, एंड एंटीऑक्सीडेंट भी होते हैं. एंड ओमेगा 6 के लिए लाइक सनफ्लावर हो गया हमारा, सीसम ऑयल हो गया है, एंड मस्टर्ड ऑयल हो गया है, राइस ब्रान ऑयल हो गया है. बेसिकली एवरी मंथ यू चेंज योर कुकिंग ऑयल जो हम लोग प्रिस्क्राइब करते हैं, बिकॉज हमारी बॉडी को डिफरेंट फैटी एसिड्स का रिक्वायरमेंट होता है. एक ऑयल में तो सारे फैटी एसिड्स नहीं प्रेजेंट होते हैं, सो दैट्स वाई यू चेंज योर कुकिंग ऑयल एवरी मंथ. ओके, सो ओमेगा 6 के लिए आप वेजिटेबल्स जो हो गए हैं ऑयल में कुक कर सकते हैं, एंड ओमेगा 3 जो है आपको नट्स के थ्रू लाइक आलमंड्स, वॉलनट्स, इनके थ्रू आपको मिल जाएगा. एंड जो हमारे सीड्स हो गए हैं लाइक फ्लैक्स, चिया, सनफ्लावर, वाटरमेलन सीड्स हो गया है, उनके थ्रू आपको ओमेगा 3 मिलेगा. ओके एंड हाँ, प्रोटीन्स भी होता है, जो सीड्स होते हैं उनके अंदर आयरन भी होता है, जिंक, मैग्नीशियम, प्रोटीन सब होता है। एंड सबसे बेस्ट है किनोवा सीरियल जो होता है, किनोवा इज ऑल्सो गुड। वो जो होता है उसके अंदर प्रोटीन, कैल्शियम, आयरन, आपको मैग्नीशियम, जिंक वो सब मिलेगा। सो क्या होता है, अगर हम लोग जैसे डिनर ड्यूरिंग द फर्स्ट ट्राइमेस्टर वी आर फेसिंग कि हमें वॉमिट हो रहा है, एंजाइटी हो रहा है, हमें खाने का कुछ मन नहीं करता है, सो वो गलत होता है कि हम पूरा पूरा दिन नहीं खाते हैं तो हमारी बॉडी डिहाइड्रेट हो जाती है। बेसिकली हम लोग जो आपको डाइट प्रिस्क्राइब करते हैं, हेल्दी एक राइट डाइट यू कैन प्रेफर एंड अ स्मॉल फ्रीक्वेंट मील्स यू कैन हैव, लाइक हर 2-3 घंटे में हल्का हल्का कुछ ना कुछ लेते रहना चाहिए ताकि डिहाइड्रेशन भी ना हो। अगर व्हेन यू वेक अप इन द अर्ली मॉर्निंग, सो क्या होता है हम लोगों को सबसे ज़्यादा फर्स्ट ट्राइमेस्टर में यही होता है कि हम उठते हैं और वी आर फीलिंग कि नोजिया हो रहा है। सो अपने रात को बेड साइड में सोते टाइम कुछ बिस्किट्स लाइक ड्राई बिस्किट जो हमारे बिस्किट्स हो गए वो, या फिर रस्क हो गया, या अगर आपको कोई फ्रूट रखना है कुछ ऐसा, बिकॉज हाइपोग्लाइसीमिया हो जाता है। आपने रात में डिनर किया 8 o'clock या 9 o'clock एंड काफ़ी फिर 10 o'clock आप दूध पी के सिंपल सो गए हो, तो काफ़ी टाइम हो जाता है ड्यूरिंग दैट लाइक 10 और 11 आवर्स लाइक आप भूखे हो, तो यू आर गोइंग फ्रॉम अ हाइपोग्लाइसीमिया। तो उस टाइम पे जैसे आप उठते हो तो एक बिस्किट यू कैन हैव, हाफ और 1 बिस्किट यू कैन हैव, ताकि आपको नोजिया ना हो, वॉमिट ना हो अर्ली मॉर्निंग में। एंड फर्स्ट ट्राइमेस्टर जो होता है आपका, उसमें जो आपको डाइट है वो हाई कार्बोहाइड्रेट्स हम आपको बोलते हैं, लाइक हमारा शकरगंदी चाट आप ले सकते हो, रोस्टेड चना चाट आप यू कैन प्रेफर, किनोवा सैलेड यू कैन हैव, सो लाइक पोटैटो चाट यू कैन प्रेफर, ताकि कार्ब्स का इंटेक ज़्यादा से ज़्यादा हो। एंड लाइक हमारा मैक्रो एंड माइक्रो न्यूट्रिएंट्स प्ले अ मेजर रोल इन योर प्रेगनेंसी, ड्यूरिंग द प्रेगनेंसी और आफ्टर प्रेगनेंसी बोथ। मैक्रोन्यूट्रिएंट्स आर लाइक कार्बोहाइड्रेट्स, प्रोटीन एंड फैट, एंड माइक्रोन्यूट्रिएंट्स आर लाइक हमारा जो कम अमाउंट में हमें चाहिए होता है, लाइक हमारा आयरन हो गया, कैल्शियम हो गया, फॉलिक एसिड, जिंक, मैग्नीशियम, दीज आर माइक्रोन्यूट्रिएंट्स जो हमें कम अमाउंट में चाहिए होता है। एंड डॉक्टर्स मोस्टली आपने देखा होगा, गायनेकोलॉजिस्ट जो हैं आपको सप्लीमेंट्स भी प्रेफर करते हैं, आयरन सप्लीमेंट लाइक फॉलिक एसिड का सप्लीमेंट देंगे आपको, कैल्शियम सप्लीमेंट्स देंगे, बिकॉज जो आपको डाइट के थ्रू आप नहीं कवर कर पा रहे हो तो आप सप्लीमेंट्स के थ्रू वो कवर कर लो। सो इसीलिए डॉक्टर्स आपको मेडिकेशन भी प्रिस्क्राइब करते हैं। एंड वन मोर थिंग, वो बोलते हैं कि आयरन और कैल्शियम का कॉम्बिनेशन एक साथ, मतलब दोनों टैबलेट्स एक साथ नहीं खाने चाहिए, बिकॉज बोथ आर इनहिबिट ईच अदर, सो नहीं करना। या तो आधा 1 घंटा पहले आयरन खा सकते हो, आधा 1 घंटा बाद आप कैल्शियम का टैबलेट खा सकते हो, लाइक दैट, ठीक है। एंड वन मोर थिंग कि डॉक्टर्स आपको ये भी सजेस्ट करते हैं कि अगर आप आयरन का सप्लीमेंट ले रहे हो तो आप विटामिन सी लाइक नींबू पानी के साथ ले लो, ताकि डाइजेस्ट जो है आयरन जो है इजीली डाइजेस्ट हो जाए। आयरन का मेडिकेशन खाने के बाद क्या होता है, मोस्ट ऑफ द वुमेन्स फेस कि उनको गैस्ट्राइटिस हो रहा है, नोजिया फील होता है, गैस्ट्राइटिस होता है, तो इसीलिए हम लोग बोलते हैं आयरन का एब्जॉर्प्शन जल्दी होने के लिए नींबू पानी के साथ, अगर नींबू पानी का किसी को मतलब एसिडिटी हो रही है, नींबू पानी नहीं सूट कर रहा है, उसको अल्टरनेट आप आंवला की चटनी ले लिया आपने, तो मैं तो सूप ले लिया है, या फिर एक ऑरेंज खा लिया है, या फिर विटामिन सी का जो सप्लीमेंट आता है वो प्रेफर कर सकते हो, ताकि उसका डाइजेशन इजीली एंड फटाफट हो जाए एंड यू आर नॉट सफरिंग फ्रॉम गैस्ट्राइटिस एंड ऑल, ठीक है। एंड द अदर थिंग इज़ प्रोटीन। बेसिकली अगर आपका वेट 50 ग्राम है तो 1 ग्राम पर केजी बॉडी वेट प्रोटीन का रिक्वायरमेंट तो हमारी बॉडी को होता ही है, बट ड्यूरिंग द प्रेगनेंसी हम लोग जो है प्रोटीन का रिक्वायरमेंट जो है बढ़ा देते हैं, बिकॉज फीटस डेवलपमेंट हो रहा है बेबी की ग्रोथ के लिए और उसका टिश्यूज बिल्डअप हो रहा है, तो उसके लिए हम प्रोटीन का रिक्वायरमेंट 1.5 to 1.2 कर देते हैं। लाइक अगर आप 50 ग्राम्स ले रहे हो तो हम लोग बोलते हैं आपको 65 to 70 ग्राम आपको प्रोटीन का जो है इंटेक होना चाहिए पर डे। सो ज़रूरी नहीं है कि आपकी नॉनवेज डाइट के थ्रू ही हम लोग प्रोटीन का जो है, कुछ पीपल क्या होते हैं, सम आर वेजिटेरियंस एंड सम आर नॉन वेजिटेरियंस, बट यू नो डॉक्टर नितिका ने भी हमारे पिछली टॉक में बताया था कि नॉनवेज को डाइजेस्ट होने में काफ़ी टाइम लगता है। अगर वेज डाइट को डाइजेस्ट होने में 8 आवर्स लगते हैं, सो नॉनवेज को डाइजेस्ट होने में 72 आवर्स लग जाते हैं। सो इट्स बेटर कि आप वेज यू कैन प्रेफर, वेज के थ्रू आप प्रोटीन्स का इंटेक लें। सो वेज में जैसे हमारे स्प्राउट्स हो गए हैं, पल्सीज हो गई हैं, राजमा छोले हमारे दालें, इंस्टेड ऑफ हल्की मूंग मसूर की दाल की जगह आप राजमा छोले यू कैन प्रेफर। ऐसा नहीं होता कि राजमा छोले खाने से ड्यूरिंग आपके इन लॉज या हमारे भी ये मिथ्स होते हैं कि राजमा छोले खाओगे तो गैस बन जाएगी आपको, नहीं, आप वॉक करो, खाना खाने के बाद 10 मिनट के बाद आप वॉक करोगे ना तो खाना भी इजीली डाइजेस्ट हो जाता है, आपको गैस्ट्राइटिस नहीं फेस करना पड़ता है, ठीक है। सो हमारा मिल्क एंड मिल्क प्रोडक्ट्स हो गए हैं, अगर किसी को क्या होता है लैक्टोज इंटॉलरेंस होता है, दूध डाइजेस्ट नहीं होता, तो उसकी जगह पे आप उसको अल्टरनेट आप सोया मिल्क यू कैन प्रेफर, बट फोर्टिफाइड लो जो कि कैल्शियम भी उसके अंदर आपको मिल जाए। अदरवाइज बटर मिल्क, कर्ड, योगर्ट वो भी आप ले सकते हो जो, और पनीर हो गया हमारा प्रोटीन का सोर्स, ये सब आप प्रेफर कर सकते हो। एंड द अदर वन इज़ फैट्स। फैट्स का जैसे हमने पहले भी अभी थोड़ी देर पहले डिस्कस किया, ओमेगा 3 एंड ओमेगा 6 का कॉम्बिनेशन लेना चाहिए इंस्टेड ऑफ आप जैसे ऊपर से एक्स्ट्रा बटर घी, बिकॉज हमारा कोलेस्ट्रोल कुछ कुछ वुमेंस का आपने देखा होगा रिपोर्ट्स में प्रेग्नेंट वुमेंस का कि उनका कोलेस्ट्रोल हाई हो जाता है। भर भर के सासू माँ वगैरह जो हमें लड्डू खिला देंगी, घी रखेंगी नहीं, बच्चा हेल्दी होगा, बच्चे का वेट गेन नहीं हो रहा होगा तो आप बटर खाओ, घी खाओ, नो। आपको जितना प्रेगनेंसी से पहले फैट का रिक्वायरमेंट होता है उतना ही प्रेगनेंसी के ड्यूरिंग भी होता है, एंड लैक्टेटिंग जो मदर्स होती है उसके बाद भी उनको उतना ही फैट का रिक्वायरमेंट होता है। जरूरी नहीं है कि आपको फैट के थ्रू ही सारा कैलोरी रिक्वायरमेंट पूरा करना है, नो। आप ऑयल्स जो आप खाने में तड़का लग रहा है उसके थ्रू आपको मिल रहा है, कुछ अगर आप रोटी ले रहे हो तो हल्का सा हम बटर या घी उस पर लगाते ही हैं। सो आपका जो पूरे दिन का है 20 ml जो आपको रिक्वायरमेंट होता है फैट का वो पूरा हो जाता है। और कैलोरीज आपको कार्बोहाइड्रेट्स, इंडिया में तो सबसे ज़्यादा कार्बोहाइड्रेट्स मिलते हैं, लाइक हमारा वीट हो गया है, राइस हो गया है, पास्ता, ब्रेड्स एंड नूडल्स, ओके। एंड बेसिकली होता है हमें कॉन्स्टिपेशन बहुत रहता है वुमेंस को इन 3rd ट्राइमेस्टर एंड 2nd ट्राइमेस्टर, और हम लोग फेस करते हैं कॉन्स्टिपेशन का प्रॉब्लम। सो उसके लिए आपको डाइट में जो है फाइबर का इंटेक ज़्यादा से ज़्यादा इंक्रीज़ करना चाहिए। अगर आपको बहुत ज़्यादा गैस्ट्राइटिस हो रहा है तो ज़रूरी नहीं है कि आप स्प्राउट्स को थोड़ा सा 5 या 2 मिनट के लिए स्टीम करके भी खा सकते हो। स्प्राउट्स अगर आप ले रहे हो तो स्प्राउट्स आर ऑल्सो रिच सोर्स ऑफ प्रोटीन हो गया है हमारा, एंड फाइबर का भी गुड सोर्स है, एंड वाइटामिन मिनरल्स भी होते हैं, ठीक है। एंड डेट्स, टी नहीं, कैफीन इंटेक हमें ज़्यादा नहीं करना चाहिए क्योंकि वो आयरन का एब्जॉर्प्शन नहीं होने देता, इनहिबिट करता है। टैनिन्स जो भी आप गायनेकोलॉजिस्ट भी आपकी बोलेंगी कि टैनिन्स, कैफीन, अल्कोहल, स्मोकिंग ये सब ड्यूरिंग और आफ्टर प्रेगनेंसी अवॉइड करना चाहिए। सो वो हमें नहीं लेना चाहिए। अगर आप चाय लेते हो पूरे दिन में तो 1 से 2 कप, उससे ज़्यादा चाय या कॉफ़ी कुछ भी 1 या 2 कप, उससे ज़्यादा नहीं इंटेक करना है।
कॉफी इंटेक तो यूजुअली मना कर देते हैं बिकॉज 1 कप ऑफ टी इज इक्वल टू 8 कप ऑफ कॉफी।
नहीं, ऐसा कुछ नहीं है। अगर आप लाइट कॉफ़ी लेते हो तो उसमें भी कोई प्रॉब्लम नहीं है। लाइट लेना चाहिए। जो हम स्ट्रॉन्ग ब्लैक कॉफ़ी लेते हैं वो हम लोग अवॉइड करने के लिए मना करते हैं, बट या तो आप 1 या 2 कप चाय पी सकते हो, कॉफ़ी पी सकते हो, इट्स डिपेंड अपॉन योर चॉइस, ऐसा नहीं होता है। सेम सो एंड हम लोग मेजरली जो है कुछ आदत होती है हमें कि हम ब्रेकफास्ट के साथ हम लोग चाय पी रहे होते हैं, पराठे ले लिए और चाय ले लिया, बट ये गलत कॉम्बिनेशन होता है बिकॉज जो चाय होता है या कॉफ़ी होता है उसके अंदर टैनिन्स और हमारा कैफीन होता है जो कि आयरन का अब्जॉर्प्शन होने ही नहीं देता। जो हमें खाने से जो न्यूट्रिएंट्स मिलने वाले हैं, जो प्रोटीन मिलने वाला होता है, उनका डाइजेशन नहीं होता। वो जो हमने खाना खाया वो सारा वेस्ट ही है हमारे लिए। अगर आपको ज़्यादा चाय का वो है तो आप अर्ली मॉर्निंग में जैसे आपने सुबह सबसे पहले उठोगे तो 1 ग्लास पानी ही पीना है, हैविंग अ कप बिस्किट, 1 बिस्किट या फिर फिग ले लिया है, अपने सीड्स रखे हैं आपके साइड में, बेड साइड में, वो सीड्स खा लिए हैं। उसके बाद आप थोड़ी देर के बाद एक कप चाय ले सकते हो लाइट, बट खाली एम्प्टी स्टमक आप चाय एसिडिटी कॉज करेगा आपको, ठीक है। एंड लाइक ब्रेकफास्ट, लंच एंड डिनर जो हमारी 3 मेजर मील्स होते हैं उनके साथ आपको टी कॉफ़ी अवॉइड करने के लिए हम लोग एडवाइस करते हैं। 1 या 2 कप टी इज़ फाइन बट नॉट मोर देन 2। एंड लाइक व्हेन यू आर लैक्टेटिंग तो हम लोग मोस्टली मदर्स क्या बोलती हैं कि दूध पिलाओ तभी आपको ब्रेस्ट फीड हो, मिल्क फॉर्म होगा। ऐसा कुछ नहीं है। आप बटर मिल्क 3 ग्लासेस, 2 और 3 ग्लासेस इज ओके। बट जो हमारा कैलोरी का रिक्वायरमेंट होता है आफ्टर प्रेगनेंसी, मतलब व्हेन यू आर इन लैक्टेटिंग फेज, सो वो हमारा कैलोरी रिक्वायरमेंट इंक्रीज़ हो जाता है क्योंकि आपका बेबी फीड कर रहा है। और हम लोग क्या सोचते हैं कि हम लोग डाइटिंग कर लेते हैं अब क्योंकि हमारा वेट गेन हो जाएगा, हम ज़्यादा दूध नहीं पियेंगे, या मदर इन लॉज बोलते हैं कि रोटी खा लो, ये कर लो। नो, ऐसा कुछ नहीं है। अगर आप बेबी को फीड करवा रहे हो तो आपकी कैलोरीज ऑलरेडी बर्न हो रही हैं। सो एक हेल्दी डाइट आपको प्रेफर करना है। जैसे ड्यूरिंग द प्रेगनेंसी जो आप डाइट ले रहे थे, आफ्टर प्रेगनेंसी भी आपको सेम ही डाइट लेना है। बेसिकली स्मॉल फ्रीक्वेंट मील्स, ये नहीं कि आपने सुबह नाश्ता कर लिया उसके बाद आप कुछ भी नहीं खाया, शाम को आप कुछ ऐसा आपने कुछ भी आपने जंक लाइक ऐसे आपने खा लिया, सो वो गलत है। और उसके क्या होगा, आपने कैफे जो आपका टाइम है, टाइम शेड्यूल है 2 से 3 घंटे के बीच में आपको कुछ ना कुछ खाना है, अगर आपने 4 और 5 आवर्स कर दिया तो आपको आई एम श्योर आपको मर्चिंग होगा कि हाँ मुझे कुछ ना कुछ खाना है बस, फिर तो बहुत ज़्यादा क्रेविंग ही हो जाती है, ये इससे तो मेरा पेट टमी फुल नहीं हुआ, मुझे और दो, फिर वो हमारा वेट गेन के उसमें हम चले जाते हैं। सो वो नहीं करना चाहिए। अगर आपको एक्स्ट्रा कैलोरीज चाहिए हैं तो आप कैलोरीज अपने जो फैट है, जो आपका ओमेगा 3 और ओमेगा 6 का हमने बताया उसके थ्रू हो गया है। अगर मदर इन लॉज अगर आपको पंजीरी बना के उसके अंदर अगर पंजीरी बना के दे भी रही हैं तो कोई बात नहीं, बट उसके अंदर घी कम, नट्स और सीड्स ज़्यादा होने चाहिए आपके। जैसे हम लोग बोलते मदर इन लॉज जो है, नो आफ्टर डिलीवरी अगर आपको लेना है तो उस टाइम पे आप ले सकते हो घी का। अगर जैसे मदर इन लॉज अगर लड्डू बना के दे रही हैं आपको तो उसमें घी कम, नट्स और सीड्स ज़्यादा होना चाहिए। सो तो ताकि आपको जो कैलोरी का रिक्वायरमेंट है सो वो कंप्लीट हो जाएगा। नो आपको मैंने बोला नट्स खाओ, सीड्स खाओ, वो बेबी को पुश करने के लिए जो होता है वो एक मिथ्स है, वो मेरी मदर इन लॉ खुद की मुझे बोलती हैं तो मैंने मना कर दिया, मैंने कहा मम्मी वो मैं नहीं कर सकती हूँ, नहीं होता, नहीं ऐसा कुछ नहीं है। एक्सरसाइज करो, फ्रूट्स खाओ, एक्सरसाइज जो है सबसे मेजर इंपॉर्टेंट रोल प्ले करती है। और कुछ क्या होता है कि बेड से ही नहीं उठना अभी तो आपको 1-1.5 महीने तक आप लेटे ही रहना है, नहीं हिलना भी नहीं है, सो वो गलत होता है। उस फेस में हम लोग वेट गेन कर लेते हैं पोस्ट डिलीवरी। हाँ ऐसा नहीं है, आप ब्रेस्ट वॉक तो तब भी कर सकते हो, अगर नॉर्मल डिलीवरी हुआ है तो नॉर्मल है, तब तो आप ब्रेस्ट लाइक आपने ब्रेकफास्ट किया है, लंच किया है, गेस्ट्राइटिस हो रहा है आपको तो आप वॉक करो ना, ब्रेकफास्ट लंच डिनर तीनों मेजर मील्स के बाद आप वॉक करो, 10 मिनट बैठो एंड देन यू वॉक 15 to 20 मिनट्स, ताकि गैस भी आपको पास होगा और यू आर फीलिंग लाइट, फूड जो है फैट में भी कन्वर्ट नहीं होगा, डाइजेशन में भी आपके प्रेशर नहीं पड़ेगा। सो वॉक तो कंपल्सरी होता है। सिजेरियन में हम लोग बोलते हैं थोड़ा सा लाइट, लाइक जब डॉक्टर्स आपके प्रेस्क्राइब कर देते हैं 3 और 5 डेज के बाद, लाइक बट उसमें भी हम लोग डॉक्टर्स भी यही बोलते हैं कि वॉक करो, 3 डेज के बाद आपको डॉक्टर खुद बोल देंगे कि आप वॉक करो, ब्रेस्ट वॉक करो, ताकि गैस पास हो आपको। होता है सिजेरियन के बाद कि अभी आप लिक्विड डाइट पर हो, देन यू आर ऑन सॉफ्ट डाइट, लाइट ही लेना है, आफ्टर दैट व्हेन यू पासिंग मोशंस यू आर ऑन नॉर्मल डाइट। बट और मेन होता है कि आपकी मदर इन लॉ बोलेंगे कि आपने राजमा छोले खा लिए, जैसे अभी मैम भी बता रही थी, डॉक्टर दीप्ति भी, कि राजमा छोले खा लिए बच्चे को इसलिए गैस बन गया। नो ऐसा कुछ नहीं होता है, राजमा छोले खाने से बच्चे को गैस बेसिकली क्या होता है, हम लोग बेबी मिल्क फीड कर रहा हो तो उसके बाद उसको बर्प करवाना जरूरी होता है, अगर वो बर्प नहीं करता है तो उसको गैस्ट्राइटिस होता है, सो वो जरूरी है। मदर के राजमा छोले खाने से बच्चे को गैस नहीं बनता है। या हाई प्रोटीन डाइट यू कैन प्रेफर, हाँ, बिकॉज हीलिंग में भी आपको हेल्प करते हैं, जो स्टिचेस लगे होते हैं उसमें भी आपको हेल्प करते हैं। एंड लाइक अभी जैसे हम लोग मदर इन लॉज हैं जो लड्डू वगैरह की बात करते हैं, सो आप पानी उनका पी सकते हो आफ्टर डिलीवरी, लाइक अजवाइन, मेथी, जीरा और सौंफ, आप इनको 10-10 ग्राम लेके 1 लीटर पानी में रात को आप सोक करके रख दो, सुबह उठ के सिम गैस पे बॉईल करना है, छान के वो पानी आप बॉईल पी सकते हो। अगर किसी से सुबह खाली पेट पिया जा रहा है तो खाली पेट पी लो, नहीं तो होल डे अगर पी सकते हो तो सिप सिप करके पी सकते हो उसे, वो आपको मिल्क फॉर्मेशन में भी हेल्प करेगा, गैस पास होने में भी आपको हेल्प करेगा। अगर आपका जैसे कुछ मीठा खाने की क्रेविंग है तो आप जैगरी और सॉफ्ट खा सकते हो, सॉफ्ट डाइजेशन में आपको हेल्प करता है, और जैगरी इज आयरन रिच, क्योंकि डॉक्टर्स आफ्टर डिलीवरी भी बोलते हैं कि आप लोग जो है अपना सप्लीमेंट सब पे आपको रखते हैं, लाइक आपका आयरन सप्लीमेंट, कैल्शियम सप्लीमेंट्स, बिकॉज आफ्टर डिलीवरी आपका जो ब्लीडिंग ब्लड जो लॉस हो रहा है तो उसको कवर करने के लिए, सो वो तो आपको कंटिन्यू रखना पड़ता है। और स्पिनच खाने में भी कोई रेस्ट्रिक्शन नहीं होता, स्पिनच का आप सूप पी सकते हो, वो भी आयरन रिच है, फॉलिक एसिड है। बट जो भी आप खाओगे ना, लाइक अगर आपने खाना ले रहे हो तो उसके साथ सैलड ले रहे हो तो उसके ऊपर हल्का सा नींबू स्क्वीज कर लेना है, ताकि विटामिन सी जाए, जो कि आयरन के एब्जॉर्प्शन के लिए गुड होता है। साथ के साथ मसाला नहीं, ऐसा कुछ नहीं है। बेसिकली ये हम लोग अवॉइड करने के लिए आपको प्रेफर करते हैं कि रेड चिलीज यू कैन अवॉइड, इंस्टेड ऑफ रेड चिलीज यू कैन प्रेफर ग्रीन चिली एंड ब्लैक पेपर। ग्रीन चिलीज आर विटामिन सी रिच एंड ब्लैक पेपर आर विटामिन ए रिच, सो हेल्दी। रेड चिली आपको जो इन्फ्लेमेशन करेगी पेट में, जलन वगैरह, आपको एसिडिटी फॉर्म होगा, सो इट्स फाइबर, हाई फाइबर डाइट एंड पानी का इंटेक जो है थोड़ी थोड़ी देर में करते रहना चाहिए, बिकॉज आप बेबी को फीड करवा रहे हो तो आप ऑलरेडी डिहाइड्रेट हो जाते हो, आपको खुद को ही मतलब यू आर फीलिंग थर्स्टी कि मुझे प्यास लग गया, तो सिप सिप करके पानी पीते रहना चाहिए ताकि डिहाइड्रेशन भी ना हो आपको। और फाइबर का इंटेक तो ड्यूरिंग द प्रेगनेंसी और आफ्टर प्रेगनेंसी करना ही है। बोलते हैं कि पपाया नहीं खाना उससे गैस बन जाएगा, नहीं, पपाया इज़ गुड, वो आपके मोशन में डाइजेशन में भी हेल्प करता है। सो सारे फ्रूट्स, जितने भी फ्रूट्स हो गए रॉ की जगह आप कुकिंग फॉर्म में, ऐसा नहीं है, खा सकते हैं हम लोग को, हम नहीं, हम लोग पाइनएप्पल भी हम लोग खा सकते हैं, बट जो उसके पपाया जो होता है उसके अंदर पेपेन एंजाइम होता है जिसकी वजह से हम लोग अवॉइड करने के लिए बोलते हैं। अगर आप उसका जो लेयर है ऊपर का जो वाइटिश लेयर है उसको कट करके और नीचे का लेयर कट के 4 और 5 पीसेज, अगर हमें बहुत क्रेविंग पपाया खाने का मन है तो हम खा सकते हैं। वो पहले मिथ्स होते थे कि पपाया खाने से आपका मिसकैरेज हो जाएगा, नहीं, बट आजकल जो लेटेस्ट स्टडीज़ हुई हैं ऐसा कुछ नहीं है उसमें। पपाया, पाइनएप्पल हम लोग सब खा सकते हैं। 9th जब आपका मंथ स्टार्ट होता है तो उसमें तो हम लोग खुद बोलते हैं कि खूब सारा पपाया पाइनएप्पल खाओ, वो मिथ्स होते हैं, ऐसा कुछ नहीं है कि पपाया नहीं खा सकते हो, पाइनएप्पल नहीं खा सकते हो, मैं खुद खाती हूँ।
आप ये क्लास लेने पहले क्यों नहीं आए? 9 months पूरे करा दिए, पपाया नहीं खाया।
फर्स्ट हुआ था मेरा टॉक यहाँ पे, फर्स्ट मैम की क्लास मैंने अटेंड की थी, हुआ था ये टॉक, तब भी कुछ कुछ का यही क्वेरीज थी कि पपाया क्यों नहीं खा सकते हैं, पाइनएप्पल, मैंने बोला था खा सकते हैं, ऐसा कुछ नहीं है। नो, बट एक स्मॉल एंड क्वांटिटी वाइज मॉडरेशन में आप ले सकते हो, यानी कि डेली फिर आप पपाया ही पपाया खाए जा रहे हो। गुआवा खाओ, डिफरेंट डिफरेंट लाइक कलरफुल हम लोग एडवाइस करते हैं, कलरफुल वेजीज खाओ, बिकॉज हर एक में फ्लेवोनॉइड्स, कैरोटीनॉइड्स, हर से अलग अलग आपको विटामिन मिनरल्स मिलते हैं जो कि आपके बेबी की और आपकी इम्यूनिटी को स्ट्रॉन्ग करते हैं, जो कि जैसे आजकल कैंसर हो गया, डायबिटीज़ वगैरह, कितने सारे डायग्नोसिस भी वी सी। सो उसके लिए हमें डिफरेंट डिफरेंट फ्रूट्स एंड वेजिटेबल्स खाते रहना चाहिए ताकि हमारे बच्चे की इम्यूनिटी स्ट्रॉन्ग होएगी और जो डिजीजेज है उनसे फाइट करने में हेल्प करेगी। सो लाइक कलरफुल हम लोग कॉम्बिनेशन बनाते हैं ना, अपना कुछ थाली भी लिया तो थोड़ा सा राइस ले लिया है, स्पिनच की सब्जी ले ली है, सैलड्स भी हम लोग देख लो, कैप्सिकम होता है, रेड वाला कैप्सिकम, येलो कैप्सिकम, कुकुम्बर हो गया है हमारा। सो डिफरेंट डिफरेंट कलरफुल, वो देखने में भी हमें एक अट्रैक्टिव लगता है और फिर मतलब वही है, हमें जो डिफरेंट डिफरेंट विटामिन मिनरल्स होते हैं वो सब हमारे जो बॉडी को रिक्वायरमेंट होती है वो भी पूरा हो जाता है।
क्या कहते हैं कि बच्चे की डेवलपमेंट के लिए, ब्रेन डेवलपमेंट के लिए स्पेशली फिश, आई एम अ वेजिटेरियन, तो उसमें फिश ऑयल ले सकते हैं?
ओमेगा 3 का बोलते हैं। सो ओमेगा 3 मैंने अभी आपको बताया कि आप लोग जो है सीड्स के थ्रू, नट्स के थ्रू जो है उसके थ्रू भी अपना रिक्वायरमेंट जो पूरा कर सकते हो। हाँ, वो ड्यूरिंग द प्रेगनेंसी हम लोग वो डॉक्टर्स आपको प्रिस्क्राइब करेंगे, बट अगर आप सीड्स और नट्स से जो ओमेगा 3 आपको जितना चाहिए रिक्वायरमेंट हमारी बॉडी को तो उतना आपको मिल जाता है। सो ज़रूरी नहीं है कि आपको फ़िश या नॉनवेज ही आपको लेना पड़ेगा। सो ज़रूरी नहीं है आपको कि नॉनवेज के या कैप्सूल्स के थ्रू ही आपका ओमेगा 3 कंप्लीट होगा। आप सीड्स खाओ, 30 ग्राम्स पर डे हम लोग रिकमेंड करते हैं। और रेजिन्स यू कैन हैव, रेजिन्स भी खा सकते हो सोक करके, अगर आप आयरन का, जैसे आयरन का डेफिशिएंसी हम लोग बोलते हैं, लाइक हमारा रोस्टेड मल्टी सीड्स जो होते हैं, फ्लैक्स, चिया, सनफ्लावर, वाटरमेलन और हमारा पम्पकिन सीड्स। नहीं, ऐसा कुछ नहीं है, रोस्टेड होने के बाद उनका उल्टा टेस्ट में भी आपको ठीक लगेंगे, क्रिस्पी हो जाते हैं। अगर आप रॉ खाओगे तो आपको खाने में प्रॉब्लम होगा, टेस्ट भी आपको अच्छा नहीं लगेगा, आप खा ही नहीं पाओगे। इट्स बेटर थोड़ा क्रिस्पी होंगे, टेस्ट बर्ड्स भी उसमें इंप्रूव होते हैं, तो अब वो आपका। अगर कुछ कुछ वुमेंस जो प्रेग्नेंट हैं और हाइपरटेंशन का जिनको प्रॉब्लम होता है तो हम लोग उनको बोलते हैं कि सॉल्ट वाले रोस्टेड मल्टी सीड्स नहीं लेना, विदाउट सॉल्ट यू कैन हैव। और डायबिटीज़ जिनको होता है, जेस्टेशनल डायबिटीज़, सो उनके लिए तो बहुत अच्छा है सीड्स, बट उनको हम लोग प्रिस्क्राइब करते हैं कि शुगर, हनी, जैगरी ये सब आपको अवॉइड करना है। कैरेट्स आपको अवॉइड करना है, कैरेट्स के अंदर सबसे ज़्यादा फ्रक्टोज शुगर होता है। लाइक इंस्टेड ऑफ जूसेस यू कैन प्रेफर फ्रूट्स डायरेक्टली, फ्रूट्स आप ले सकते हो ताकि फाइबर भी जाएगा। जूसेस से क्या होगा कि आपको जो शुगर का इंटेक है वो ज़्यादा हो जाता है एंड उससे एसिडिटी भी आपको कॉज होता है ज़्यादा जूसेस पीने से। सो इंस्टेड ऑफ लाइक जूसेस एंड ऑल यू कैन प्रेफर डायरेक्टली फ्रूट्स, ताकि फाइबर भी जाए, आपको कॉन्स्टिपेशन का प्रॉब्लम ना हो, मोशन इजीली पास हो जाए और जो आपको विटामिन मिनरल्स का रिक्वायरमेंट है वो भी आपका कंप्लीट हो जाए। एक सबसे बड़ा मिथ होता है कि अनार के अंदर आयरन होता है, अनार खाओ बेटा खूब सारा खून बनेगा, नहीं, ऐसा नहीं होता। 1.5 मिलीग्राम सिर्फ आपको जो है आयरन मिलेगा उससे mg। डाइजेशन या लेकिन या वो तो लेकिन मैं आपको मिथ बता रही हूँ, ये जो मेजरली जो है मिथ होता है लोगों का कि अनार का जूस पीने से आपका खून बढ़ जाएगा, ना, वो एक बहुत बड़ा मिथ है, ऐसा नहीं है वो एक सबसे बड़ा मिथ है। उसकी जगह मैंने अभी आपको बोला रेजिन्स, आप 5 रेजिन्स सोक करके आप ले सकते हो। एक फिग आपने सोक कर लिया, फिग इज़ गुड, वो आपका फाइबर रिच भी है, और जैसे नेचुरल स्वीटनर भी है, अगर आपको वैसे लेना है तो नेचुरल स्वीटनर है। डेट्स हो गए हैं, बट शुगर कोटेड की जगह अगर आप विदाउट शुगर कोटेड डेट्स लेना चाहते हो तो वो आप ले सकते हो। ओके और आफ्टर जो हम लैक्टेटिंग जो मदर्स होती हैं उनको भी हम यही बोलते हैं टी, कॉफ़ी और अल्कोहल का इंटेक जो है आफ्टर डिलीवरी भी आपको नहीं करना है। बिकॉज क्या होता है हमारे ब्रेस्ट फीड के थ्रू, जैसे अगर ये एक होता है कि बेटा सिजेरियन हुआ है आपका तो आप दूध नहीं पियोगे, स्ट्रिचेस पक जाएंगे आपके, एक ये होता है सबसे बड़ा। नहीं, ऐसा कुछ नहीं है। चाय नहीं, अगर बोलते हैं कि यहाँ पे पेशेंट्स आते हैं कि बेटा दो पत्ती मतलब दो थोड़ा सा ही डाल दो बेशक, लेकिन हम दूध नहीं देंगे अपनी बहू को, हम सिर्फ उसके अंदर चाय दे दो, अब दूध के अंदर चाय। मैंने कहा क्या फ़ायदा हुआ, कैफीन जो है, टैनिन्स जो वो तो उनको मिल ही रहे हैं, प्रोटीन तो उनको नहीं मिल रहा है ना। अगर आप चाहे चाय पिलाओ, इससे अच्छा है कि आप दूध पिला दो उनको। बट दही नहीं खानी है, टमाटर नहीं देना है। क्यों नहीं देना टमाटर, वो तो विटामिन सी है, आयरन का एब्जॉर्प्शन करेगा। अगर आपने ड्यूरिंग द प्रेगनेंसी उन्होंने टमाटर खाया तो पोस्ट डिलीवरी भी तो उनको रिक्वायरमेंट है ना आयरन का। तो ये दही नहीं खाओ, दही से टाके पक जाएंगे, नहीं, वो तो प्रोटीन का सोर्स है, प्रोबायोटिक है, डाइजेशन में भी हेल्प करता है। ठंडा नहीं लेना चाहिए बेसिकली, हमें बिल्कुल ठंडा कोल्ड फूड हम खुद भी एडवाइस नहीं करते हैं, क्योंकि अगर आपको कोल्ड हो गया है तो बच्चे को भी कोल्ड होने के चांसेस, फ्लू के चांसेस होते हैं। नहीं, ऐसे नहीं, ऐसा कुछ नहीं होता है, वो सब मिथ्स होते हैं। मैंने अभी बोला ना कि दही नहीं खाना है, मना करती हैं, छाछ नहीं देना है, टमाटर नहीं देना है। बहुत पेशेंट्स आते हैं यहाँ पे, ये सब हम लोग मदर इन लॉज को मतलब क्लियर भी करते हैं। एक तो यहाँ का खुद का एक डॉक्टर थी, फिजियोथेरेपिस्ट थी, बेसिकली उनको मैंने क्लियर किया कि नहीं आप ये सब ले सकते हो, बट उनकी मदर इन लॉ नहीं, आप नहीं दोगे, मतलब बेसिकली बहू बोल रही है उनकी, ऐसा कुछ नहीं होता है। सब खाना है आपको, बट एक मिनिमम अमाउंट में, एक पोर्शन वाइज आपको खाना है। वो सब मैंने वही तो बोला मिथ्स होते हैं सबके। अभी सबसे बड़ा मिथ तो यही होता है घी पिलाने वाला, कि घी के 2-3 चम्मच दो, नॉर्मल डिलीवरी की बच्चा इजीली फ्लश आउट हो जाएगा। सबसे बड़ा मिथ होता है वो, नहीं देना चाहिए, सब मिथ्स हैं। पपाया, पाइनएप्पल नहीं खाना है, किशमिश आप नहीं खा सकते। क्यों नहीं खा सकते, सोख करके आप किशमिश खाओ, आयरन का अच्छा सोर्स है वो, डेली 5 किशमिश सोख करो और खाओ। बट जो जेस्टेशनल डायबिटिक्स हैं उनको हम लोग मना करेंगे कि वो किशमिश नहीं खाएंगी, वो फिग खा सकते हैं, फिग इज़ गुड। डेट्स उनको हम लोग एडवाइस मना करते हैं। जूसेस हम लोग उनको लिए मना करते हैं, जूसेस की जगह आप डायरेक्टली फ्रूट्स खा लो, बट फ्रूट भी अगर आप ले रहे हो तो लाइक 200 ग्राम पर डे हम लोग रिकमेंड करते हैं, नॉट मोर देन 200 ग्राम्स, बिकॉज फ्रूट्स के अंदर भी फ्रक्टोज शुगर होता है। सो इट्स बेटर कि आप अगर आपको फाइबर चाहिए तो आप सैलड्स खाओ खूब सारे, और आप स्प्राउट्स खा सकते हो। दीज आर द गुड सोर्सेज। सौते करके वेजिटेबल्स को, इंस्टेड ऑफ रॉ वेजिटेबल्स, थोड़ा सा सिम गैस पे अगर वेजिटेबल्स को बॉईल करोगे आप, लाइक हमारा मशरूम्स हो गया है, कॉलीफ्लावर्स हो गए हैं कलरफुल हमारे, बीन्स हो गए हैं, पीज हो गए हैं, स्वीट कॉर्न डालना चाहते हो सो वो आप करके सौते करके वेजिटेबल्स को वो खा सकते हो। किनोवा सैलड आप खा सकते हो अगर आपका बीच में मन है, आपका खाने का बिल्कुल मन है कि मुझे रोटी नहीं खाना, तो किनोवा सैलड ले सकते हो। किनोवा को बेसिकली 5 और 10 मिनट्स की रेसिपी होती है ये। बॉयल किया किनोवा को आपने, इट्स अ सीरियल, एंड बाद में स्ट्रेन आउट किया वाटर, उसमें आप वेजीज जितना भी डिफरेंट वेजीज है वो आपकी चॉइस के ऊपर डिपेंड है। सॉल्ट डाला, ब्लैक पेपर डाला, एंड लेमन डाल लिया, लेमन थोड़ा सा स्क्वीज़ कर लिया उसके ऊपर ताकि विटामिन सी भी जाए, एंड यू कैन हैव। बहुत इजी रेसिपी एंड टेस्ट में भी अच्छी, सो वो ले सकते हो। जो भी आपको रिक्वायरमेंट है, जो कि आपको एक प्रॉपर डाइट के थ्रू आपको मिल रहा था, लाइक आपको कार्बोहाइड्रेट्स, प्रोटीन्स, फैट्स, सो वो आपको 1 टीस्पून आप उसमें ऑलिव ऑयल भी डाल सकते हो सैलेड्स में ड्रेसिंग के लिए। फैट भी आपको मिल जाएगा, प्रोटीन भी मिल जाएगा, कैल्शियम, आयरन सब मिल जाएगा। विटामिन सी के लिए आपने लेमन स्क्वीज़ कर लिया है, एंड फाइबर के लिए आपने उसमें वेजीज ऐड कर लिए हैं। अगर आप फ्रूट डालना चाहते हो उसके अंदर, अनार, पोमोग्रेनेट भी डालना चाहते हो तो वो भी आप ऐड ऑन कर सकते हो। वो आपकी चॉइस, आपके टेस्ट के ऊपर डिपेंड है कि आप क्या डालना चाहते हो। ओके किसी का कुछ क्वेरीज है, कुछ है तो आप मुझे बता दो। वैसे तो मैं मैम की हर क्लास अटेंड करती हूँ, साइड में बैठी रहती हूँ, तो आफ्टर क्लास भी आप मुझसे पूछ सकते हो।
एसिडिटी की बहुत प्रॉब्लम रहती है।
पानी का इंटेक खूब सारा किया करो, पानी इंटेक बहुत ज़्यादा करना है। जूसेस नहीं पीने हैं ज़्यादा, जूसेस की जगह डायरेक्टली फ्रूट्स लो आप, बट पानी थोड़ी थोड़ी देर में पानी पीते रहो। वॉक करो खाना खाने के बाद।
पानी का भी होता है, ऐसे पोस्ट डिलीवरी कहते हैं पानी ज़्यादा नहीं पीना चाहिए।
ऐसे वो मिथ होता है कि टमी निकल जाएगा, आपको नहीं पीना है, नहीं, उल्टा पानी हमें पीते रहना चाहिए, बिकॉज हम बेबी को फीड करवा रहे हैं, फीड के थ्रू हमारा तो लिक्विड जा ही रहा है ना, सो स्मॉल स्मॉल फ्रीक्वेंट लिक्विड्स में पानी पीते रहना चाहिए।
ठंडा तो बिल्कुल नहीं, ल्यूकवार्म।
रूम टेम्परेचर पे आप ले सकते हो। वो वही होता है कि आपको अगर कोल्ड हो गया तो बच्चे को फ्लू होने के चांसेस होते हैं, तो इसलिए ठंडे के लिए हम लोग खुद
ठंडा मीन्स नॉर्मल भी नहीं देते, वो ल्यूकवार्म ही पिलाते
नहीं,
हैं।
नॉर्मल हम रूम टेम्परेचर पे पानी पी सकते हैं,
दूध भी ठंडा पी सकते हैं।
रूम टेम्परेचर पे। हाँ, ठंडा नहीं। अभी तो प्रेगनेंसी के टाइम पे तो आप ठंडा भी पी लो, उसमें कोई वो नहीं है। एक तो मौसम का भी होता है, लाइक अभी विंटर्स हैं तो, बट समर्स में आप ठंडा दूध पीना चाहोगे तो पी सकते हो आप, ऐसा कुछ नहीं है। बट पोस्ट डिलीवरी रूम टेम्परेचर पर, बिल्कुल चिल्ड फ्रिज वाला नहीं निकाल के पीना है। कुछ और? ओके, थैंक यू।
Thank you so much.